recording. And when you're done with that, if you could also make Donna the co-host. And then I think we are good to go, Madam Chair. We have joining in the chamber is Mayor Cogswell and Councilmember Mitchell, and online is Councilmember Bowden.
All right, great. Thank you, Madam Clerk. I'd like to call the City of Charleston Human Resources Committee to order. Today is August 21st, 2025 at 4:26 p.m. If we could just have a brief moment of silence. Thank you. All right, do I have a motion to approve the May 15th, 2025 minutes?
Move for approval.
Second.
All right, all those in favor signify by saying aye.
Aye.
Aye. Any opposed? All right, the ayes have it. Old business, we have a compensation study update. I think and let me give a big welcome to our new director, Tammy O'Brien. I think she's taking this one, so welcome. Thank you for being here.
Thank you.
Are you going to give us the compensation study update, or is someone else going to?
Bringing up the presentation.
Okay, sorry, thank you.
Okay, just to kind of give everybody an idea of where we're at with the compensation study. I know it's been on hold for a little while. We are back. We start our meetings with department heads next week and division chiefs, where we will be going through a list of all the jobs by department to ensure that they're rank ordered correctly and that their architecture is appropriate and correct. We're going to meet with every department and go over this process, ensure that those pieces are right, that our job descriptions are up to date. We'll end up going back to cross-reference this with the CBIZ data, the vendor data that we had early on, and hopefully finalize our job ranking, job grades, and pay changes in the next several months. Any questions? Okay. Then I'm going to turn it over to the team.
Thanks. Hey, please, if anyone has any questions, please just speak up. I can't see y'all. I'm sorry.
I'll make just one comment. I do want to just stress that this wasn't put on pause lightly. This is something we are excited to work through, as has been discussed at this committee in the past. Reality is we just had some issues with the initial study to where the job descriptions weren't as either detailed as they needed to be or were slightly off. And when that happens, it has a real compounding effect. You don't get accurate recommendations. And so rather than be cavalier about this and just put something out to put it out, we wanted to be thoughtful about it and really dig in and make sure that we had proper input from the staff as a whole. So really do applaud the group for rolling up their sleeves and figuring out how to expedite this, because I do know and I respect completely the hardworking folks of the city of Charleston are owed this. And so we are committed to making it happen and making it happen in a very timely manner. Thank you.
Mr. Chairman, Councilman Chairman,
Yeah.
I agree wholeheartedly with the mayor. I think we need to get into this to make sure that what's going on in each department is doing what they should be doing. And because I know some things, and to me, being out in the community all the time, some things need to change. And I think by doing this, and they're getting down to the root of it, changes can be made and be made in a good manner. So I agree wholeheartedly with this and making these changes and going through all departments to make sure our staff, some of the staff, is doing exactly what they should do and being transparent on everything so far as that is concerned.
Great, thank you. And thank you, Ms. O'Brien, for that. Do you have anything else?
Yes, I'm going to turn it over
Got
to
it?
the team for the rest of the report.
Okay, wonderful. We'll move on to, if there are no other questions or comments, let's move on to new business, the Human Resources Staffing and Retention Report.
Okay, so we are going to start with our Q2 turnover, comparing it from Q2 of this year compared to last year. So turnover in the second quarter of this year decreased in all areas compared to this time last year. So sworn fire went down from 0.83 to 0.53. Sworn police went from 2.17% to 1.96%, and our non-sworn turnover is down to 2.29% from 3.57% compared to this time last year. And our projection as of Q2, so we're halfway through the year reporting wise. We've got a 7.35% turnover rate for fire, 9.25% for police, and 14.29% for non-sworn. So these numbers are a little bit higher than where we ended up last year at the end of the year. But again, we only have 6 months worth of data that we're using to formulate this prediction. So we're hoping that this will continue to decrease throughout the rest of the year.
Can I just ask a quick question?
Sure.
What's considered like normal in for just kind of cities across the board?
What would you think, Tammy? Maybe 10 to 15%?
That's the exact number I was going to give. Nationally, 12% is considered actually rather good, 10 to 12%. Rather standard is 12 to 15% in government.
Perfect. Thank you.
All right. Thank you. Does that complete your report?
Not quite. So next
sorry,
we
go
have
ahead.
our staffing levels. So fire and police, the fire department is 90% staffed and police is 91% staffed. So really good numbers there, and we're around 1% more staffed than we were this time last year. So we are improving year to year. And then our last section here is our non-sworn vacancy rates by department. So budget, finance and revenue collections, we went up by 5%. Clerk of council up by 7%. Clerk of council, that is one of our departments that has relatively few employees in it. So when they do lose one employee, then there is a bigger impact on it, percentage-wise. Development services, we didn't report on this last quarter, but it is a 21% vacancy rate there. Our executive department, we decreased by 6%. Fire decreased by 15%. So a big part of that was from our fire marshal's office. They filled multiple assistant fire marshal and deputy fire marshal slots this quarter. Housing and community development, that did go up a little bit, but again, that's one of our departments that is pretty small. So when we have one change, it can affect the percentage. Next, HR, we decreased by 5%, IT by 2%, livability and tourism, we decreased by 9%, parks went up slightly, just by 1%, planning and preservation decreased by 6%, police 3%, public service decreased by 4%, recreation went up just a little bit by 2%, stormwater increased by 7%, and traffic and transportation by 4%. But overall, these numbers are pretty low in terms of any increases in vacancy rates. So we're looking good there too.
Great.
So now, according to our recruitment update, looking for Q2, we had our summer hires that worked for us, and that's from the month of May through August. Our non-summer hires for the quarter is a total of 48, spanned across the different departments and non-summer hires as you see listed here. Beyond that, that's not on the slide, we did just have our one of our largest firefighter classes I think that's ever been done at the city. It was 55 new hires in July, right in the middle of our move. So that was very exciting. And right now we are just moving into the fall from a recruitment standpoint to get those fall job fairs, and as we continue to work on the open positions we have. Any questions on this slide? All right. So as a move update, as you know, HR is now located with some other departments at the 200 Meeting Street. We are in Suite 305. That's the Bank of America building across from Hyman's. It's a beautiful space. Please come visit us. We've finally gotten most of the boxes unpacked and art is on the wall. The building has been great to work with to get some different things tweaked. But all in all, we're very excited and grateful for the new space. So just so you know where we are.
Great, thank you. Yeah, I guess we all just waited until you were done moving to come see you, right?
Yes.
Perfect, thank you. All right. Does that complete your report?
Just a quick question before we end the meeting, I guess, or before we move on to the next thing. Some of those vacancy rates just kind of struck me as pretty high. I think it was like 29% for traffic and transportation. Is it possible to get some more like granular details of like, what sort of jobs those are?
Yes, we can definitely get those and send those out to y'all.
Okay, thank you.
Great, thank you. Does that complete your report?
It does, yes.
Okay, well, thank you ladies so much for all that wonderful information as usual. It sounds like we're doing great. I mean, public safety, #1 priority. Sounds like we're right at the top, so that's really exciting. And but thank you for bringing all of that to us today. All right, moving on, review and request approval of proposed 2026 healthcare budget. I'm not sure who's going to take the lead on that, but you're up.
Right, Andrew is here to give a presentation on that.
Thank you, Madam Chair. I'm taking over on the healthcare budget from Jolene Deems, so I think I drew the short end of the stick on this one on replacing people. But so we're going to go over our proposed 2026 healthcare budget, some of the trends that are the justifications behind what we're setting the budget for today. So for our 2026 healthcare projections, without any kind of plan design changes or any other alterations, we're estimating an 18.4% increase on our medical and pharmacy claims. 9% of this is due to the general industry costs and inflation that are occurring. About 2.5% is increased utilization. And so when we say that, we mean more individuals are on the plan than previously, but also those who are on the plan are using the plan more frequently than they have in the past. And then just to let you know that, so we're anticipating for 2026 a 3% increase in the number of employees on the plan. And then about 6.9% of this increase is due to our large claimants. So what we've had over the past several years is the severity of our large claims have increased and the frequency or number of our large claims. And so just to give you some data for 2025, 24.5% of all of our medical and pharmacy claims are related to just large claimants alone. So 1/4 is for large claimants. And just to let you all know, large claimants it's very hard to project or prevent. That could be accidents, that could be cancer-related illnesses as well, and the treatment for those. We're estimating a 26% increase in our dental claims. This is mostly due to just industry costs increasing over time. What we've seen over the past several years is dental costs have remained relatively flat, and they're finally catching up with the rest of the medical industry. And we've also seen a larger number of enrollment on our dental plan. So for 2025 to date, we've averaged per month about 47 additional employees on our dental plan than what we were budgeting for. And so our total projected increase for over the 2025 budget with no changes to the plan is a 21% or a $4.6 million increase. So usually historically what we've seen in the total healthcare budget increase is a 2 to 3 or 4% at max. Last year we saw the largest increase, so this is a much larger increase than we're used to seeing. Part of this is also including an estimate for our stop loss fees, about 24%, and we will get those final numbers in the next several weeks when those get provided. So just some charts and graphs to provide some explanations of the history. So this chart is medical claims and enrollment, how they've changed over time at the city. So this is a percent change from the prior budget year. So the blue line is the number of enrollees, and the orange line is our medical and pharmacy claims costs. So you can see each year our medical and pharmacy claims costs have been going up 2%, just shy of 8%, a little over 8%. And our enrollment changes in 22 and 23 were actually decreases, small negative percentages. And you all may remember that in 22 and 23, we were struggling with some staffing issues. So we've been getting more staffed up, more filled positions than we have in the past. The other issue you'll see moving on from 23 and 24 and 25 is we've added a lot of firefighters with the new stations we plan on opening. So as we put more employees in the city, we anticipate they're hopping on the healthcare plan, which is more risks and more costs. So what are we doing to control some of these costs in the 2026 budget? So the number I mentioned earlier was if we do not make any kind of change, that's the estimated cost in our budget increase. So if you remember, we have two plans to choose from. We have an HSA high deductible plan. We are increasing the deductible per the IRS guidelines by $50 for an individual and $100 for families. So those are going to increase from $1,650 and $3,300 to $1,700 and $3,400. We're also increasing our other plan, the PPO plan, to match. This is something that we've done historically over time, is just to match the same increase. So we're raising them $50 and $100 respectively. That's $550 to $1,100 and $550 to $600, and then $1,100 to $1,200 for the deductibles. For dental costs, we are planning and proposing that we increase employee contributions to the dental plan. Contributions have not been increased in recent history. It's been many, many, many years since we've increased the employee contribution to the dental plan. And we are increasing the rates to match the estimated cost increase. So displayed on the screen is what we're raising the employee contributions. So the largest increase would be for someone on the family plan. They're going to go from $21 to $23.50 per pay period. That's $2.50. And over the course of the year, that's an additional $65 they're going to contribute out of their paycheck to the dental plan. We're also recommending an increase to the employee contributions for medical and pharmacy. We're recommending a 9% increase. This is half of that estimated 18.4% increase we're planning. And so we're recommending that the employees contribute more to cover half that cost, and the city will cover the other half of the cost. So the last increase we had in contributions was in 2025. That was a 6% increase. Prior to 2025, employee contributions had not been increased since 2021. So over the course of several years, the costs have increased to the city, but we have not asked the employees to contribute more until last year. So we're trying to catch up on some of those contributions. We're estimating this will generate an additional $342,000 over the course of the year to help cover medical and pharmacy costs. And we're also planning to increase retiree contributions by the same 9%. This is what the new plans would look like in the contributions. So the largest increase would be someone on the PPO plan, that's the low deductible plan, who is a smoker and on a family. That is $19.75 more per pay period is what we're asking them to contribute, which over the course of the year totals out to $513.50. Next, we just want to show how over time that employee contribution increases have not matched how healthcare costs have increased. So again, just to explain this graph, this is a year-over-year percentage change from budget to budget. So you can see the orange is the employee contributions, 22, 23, and 24. We do not have any kind of planned increase. In 25, we asked the employees to have a 6% increase in their contributions to match that same 6% increase we saw to healthcare costs. And so our proposed 2026 budget with a 9% increase is still not asking the employee to cover everything. The city's going to cover that difference between the blue line and the orange line. And then to just show over time that the city and employee cost share of the healthcare budget is not changing. We're keeping it at that same ratio. And so that's what this graph is showing is the city's cost is in blue, the employee's cost share is in orange, and we're keeping it at an 86%, 14% cost share. I'm sorry, excuse me, an 84%, 14% cost share. Just pointing out that even though increasing employee contributions, we're not asking them to cover any additional share that they have not covered in the past to costs. So one other plan design changes we're recommending is the plan to cover our GLP-1s for weight loss. So there are two categories of GLP-1 usage. There is individuals who have diabetes to use it to help control diabetes. And then there are those who use it where they do not have another condition, it's just for weight loss. And so we are recommending that we no longer cover GLP-1 solely for weight loss. We will continue to cover it for individuals with diabetes, but not for weight loss. So to give some data behind what's driving some of these costs is in 2025, we had about an average number of 65 users. That's 2% of all of our members. And this accounts for 12% of all of our pharmacy claims. So 2% of the individuals are resulting in 12% of all of our pharmacy claims. To date in 2025, that's right now estimated around $500,000. Our year-end projection is being for 2025 that the GLP-1s for weight loss will cost the city over $1 million. So we do know that in the industry out there as employers, it's unusual. We're in the smaller minority of actually covering the GLP-1s for weight loss. And it's a very small population that's driving a relatively significant portion of the total costs. So the overall healthcare budget comparing 2025 to 2026, with these changes that we're recommending, instead of seeing an 18.4% increase in the total healthcare budget, we're anticipating a 16.4% increase. So we're estimating that our medical costs are going to go $3.1 million over budget, or increase from last year's budget. Our dental costs will increase $290,000. That's a 26% increase. And that bottom number, like I mentioned down there, is instead of the 4.6 million with no changes we were estimating, we think we can reduce it down to $3.6 million. And just to summarize what I just mentioned, 3.6 million increase of 16.4% over 2025. Employees are contributing or covering the same amount of costs, about 16% of the costs. And we're looking at ways to control costs long term. That's our next goal. So Madam Chair, that's it for my presentation. If anyone has questions.
Wonderful. Thank you, Andrew. And we love hearing from you. I don't think you drew the short straw at all. I think that was, thank you for picking up the baton and running with it.
I have a few questions.
All right. Are there any questions? Yeah, go ahead, Councilmember Bowden.
Would you mind bringing the PowerPoint back up and going to the slide comparing what healthcare costs will do like for the individual employee, like what they'll be contributing from their paycheck?
This slide.
Okay. And I'm just going to look at that for a second while I'm asking my first question. I hear you on the GLP-1s. That I understand that most employers are not covering that. That strikes me as pretty short-sighted. If we're trying to control costs long term, if these things are. And I'm not a doctor. I don't take it, but they do seem to have some pretty incredible benefits for people trying to lose weight And if like the number one driver of healthcare costs in America is obesity, which I think it probably is, that seems like it's going to control our costs long term if people are using it solely for that purpose. Has any thought gone into the short-term benefits versus the long-term benefits of covering that now?
Yes, sir. So in discussions with our insurance broker, there's, like you mentioned, there's a lot of different varying opinions on this, especially the long-term benefits compared to the short-term costs that occur. So right now on the plan, or at least in 2025, we entered into, or let me start over. Prior to 2025, we covered the GLP-1s for weight loss with essentially no restrictions other than the doctor's recommendation. And in 2025, we participated in a program that Cigna offered that set some higher restrictions that included education for the individuals who were on it. And it was created, the part of the agreement was that there was a cost savings in the short term that we would see, and we're not seeing that a part of the plan. The other thing associated with the long-term costs is we even thought about maybe for the GLP-1s for weight loss, asking that the employee copay be increased more. So just to give you an example, one of the 1 month, I think it's 1 month, it might be 90 days or 30 days, I cannot remember which, but the cost is about $1,300 and the copay is only about $40 of what the employee is paying. And with Cigna, with the way their formulary works on the copays, we cannot have a special copay for them. And what we're hearing more from the medical industry is that for the GLP-1s for weight loss is they're being recommended to stay on them longer instead of on short terms. And so that's, if you think about it, it's $1,300 every time that gets added up very quickly to prevent potential healthcare issues down the road when the employee may not be on the plan any longer, or they've left employment or retired or just something to that effect. So it's something we took into a lot of consideration, council member. We felt that with the way that such a small population is driving the current costs down, we could control some of the current costs and focus on some other long-term issues. And that's one of our goals next.
Andrew, if you could just, the number of people on the plan that were on these drugs for weight loss was how many?
It was 65 on average.
So 65 people, and that added how much to the projected healthcare budget?
So about $1 million in our 2025 year-end costs.
So 65 people, $1 million expense.
Correct.
Yeah, and that's substantial, and no argument there, and I appreciate that explanation. I mean, I figured that y'all put some thought into that, but I wanted to make sure. I just I don't have any numbers in front of me for like what a lifetime of diabetes treatment might cost, or having a heart attack and an extended hospital stay.
Just for clarity, if you have diabetes, we do cover it. It's purely for weight loss. So you talk about future.
I know, but one thing's gonna lead to the other. Is the issue, right? So like, are we?
I hear you, Councilmember Bowden. Yeah.
Yeah, I mean, it's just it's clearly a short-term versus long-term issue, and it's obviously costing a substantial amount of money in the short term. I'm surprised that they can't charge different rates given that they already do for smokers. And there's simply no argument in my mind that the health effects from obesity over time are going to be the same or worse than the health effects of smoking over time. So I'm surprised by Cigna's position. That's not to criticize anybody. But okay, it's just worth thinking about a little bit more on my end, and I'll hand up. I'll apologize. I drove some of that accident healthcare cost spending going up. So that's my bad.
Madam Chair, Ms. Pope has her hand up.
Oh, please. Yeah, please jump in, Ms. Pope.
Sure.
And
I just want
to say quickly. Go ahead.
Go
ahead, Ms. Pope.
I just wanted to jump in just kind of for perspective from last year. Last year, we struggled with this as well, just for those of you who may have been on the committee last year and those of you who may not have. And looking at Jolene's notes from last year, we looked at eliminating the coverage altogether, and that was going to be about an $800,000 savings last year. And we had less people who were using the drug last year. So we put in place the Encircle RX program as sort of a Hail Mary to see if we could get this to work from a budget standpoint. And the thought was that people would be able to understand better, have coaching on eating, exercising. They would have to check in online and do weigh-ins, et cetera. And people have been compliant with that program. But what we've not seen is that people then become independent of the drugs. It seems like they get on the drugs, but then they're going to be ongoing, and we don't really see an end to that. And then the other component I just wanted to mention is, I believe it's listed on the preferred, but with a coupon, the employee's only paying like $25. Whereas if we weren't covering this, they would be paying out of pocket, I think, upwards of $400, but we are paying the substantial cost of that as part of the problem. While it's listed as a preferred drug, we are paying significantly more as the employer to cover it, and the program doesn't really seem to be helping to address the cost control that we had hoped.
Got it. Thank you.
Thank you, Ms. Pope. And again, thank you, Councilmember Bowden. I hear what you're saying. I completely understand that perspective as well. So thank you for bringing it up. And I, again, to the mayor's point, I get it, right? So I think we just have to reevaluate what was the resolve. I mean, what was, Andrew, if I missed it, I mean, did we have, or maybe we just have to, maybe we're getting too into the weeds on this particular item, that yes, this is an increase, but we did have other increases as well, just from the market and things like that. So is this set in stone at this point? Or do we need to have further discussion?
So this is what we've directed to Cigna to make to the plan changes right now. We don't have the agreement yet, but we have to decide what we're doing in order to get everything ready for open enrollment. So this was the latest we could really take things through the HR committee with the current schedule, so that we could get that agreement to council to sign with any of these plan design changes. So if there is delay, it puts some issues on getting things ready for open enrollment.
Okay, thank you. And Mr. Mayor, would you or someone from your administration, since y'all have had a much further deep dive into this than this committee at this point, I mean, what are your thoughts, suggestions? Is this, obviously it's on the agenda, is this the healthcare budget you want approved for 2026?
I think it's a pretty good solution to an unfortunate situation that we're faced with. I mean, having this high of a year-over-year jump is unprecedented, I think. And, I will say that staff has done a pretty incredible job, I think, of getting into the weeds and trying to figure out how to address it, with as little impact on our employees as possible. And so, yeah, in general, I support what the consensus has been with staff, and I suggest we move forward.
Mm-hmm. Okay, well, obviously and if anyone has any other questions, please jump in. But if there are no other questions, then, I'd ask for a motion, and then this just for time constraints. And then if I would please ask that you send this to all council members, your presentation regarding the healthcare budget. I think that would be ideal to send to them now, so that before it gets to council, when they're voting on such a large item, they'll have more time than, 6 days to kind of take a look at it. So if you can send this to all council members, I think that would be very helpful. That way, you know, if they have any questions, concerns prior to voting, because obviously time constraints and open enrollment. So please send it to them. But if not, I would just look for a motion.
Yeah, I'll make a motion that we as a committee recommend approval to council as a whole of the proposed budget.
Second.
Is there a second? All right. All those in favor signify by saying aye.
Aye.
Aye. Any opposed? All right. The ayes have it. It'll come before council. Again, please just, if you can send that, the proposed budget and slides to the rest of council, that would be very helpful. Andrew?
Thank you very
All
much.
right. If there is nothing else, again, a big hello to our new director, Tammy O'Brien. Thank you for joining us. Sounds like you and your team have been hard at work, so we really appreciate it. And if there's nothing further, then I would move that we adjourn. Bye, everyone.